Hello, Mr. Church. My name is Will. I'm going to be your nurse today, and we're going to be conducting a complete physical head-to-toe assessment. Is the room warm enough for you?
Yes.
Do you have any questions at this time?
No.
Okay, if you would, please go to the restroom and empty your bladder and put on the gown. I observe her gait. Her gait is steady and smooth with no abnormalities. You can have a seat again, please. I have gathered my equipment for this assessment. We have a eye occluder and also the reflex hammer. We have a sharp and dull object. We have our cotton swab, a pill bottle to test for stereogenosis. I have my stethoscope. We have the Snellen eye chart, and we're instead of using a Jaeger card, we're going to use one of our textbooks. I previously took Miss Church's vital signs, and they are 98. The temperature is 98 orally. The pulse is 78, and that was on the right side radial pulse site. Respirations are 14, and they are even and unlabored. The blood pressure is 110/60, and that was on the right arm and in the sitting position. Her height and weight is 68 inches tall and 120 pounds. How old are you?
20.
She appears to be 20, and she identifies as a female gender as she is. Can you tell me what today is?
May 1st.
And where are we?
Home.
And what are we here to do?
Head-to-toe assessment.
Okay, can you put your arms out for me, please? At this time, I am going to assess her skin using the dorsal side of my hand. It appears to be smooth and warm to touch. I'll also go ahead and observe the nails. They are short and well groomed with no clubbing. I'll go ahead and check the capillary refill, and it is less than 1 second. Is it okay if I touch your hair?
Yes.
The texture is smooth and it appears to be evenly distributed throughout the head. Do you have any hair products in your hair at this time?
No.
Okay, and do you ever have any problems with the ends of your hair breaking?
No.
Okay, good. I'm going to go ahead and check for skin turgor since I forgot to do that on the last video. Check just below the clavicle. Skin turgor rebounds nicely with no tinting. Now I'm going to palpate the scalp for any tenderness. Do you feel any tenderness anywhere that I'm pressing on?
No.
Okay, the scalp is smooth, has no lesions or abnormalities, and there are no parasites in the head. The skin is consistent with the rest of the body. The head is normocephalic. Now I'm going to check palpate the sinuses. Do you feel any pressure or tenderness?
Pressure.
She feels pressure in the maxillary. Pressure or tenderness?
Pressure.
Just feels pressure. Okay. Now I'm going to check the temporal artery, which is just above the ear. The artery has no bounding and there's no viscosity in the pulse. Now I'm going to check for T and J. Can you open your mouth real big for me, please? Okay. The joint was smooth. There was no cracking or grinding or anything. Now I'm going to move on to the trigeminal nerve and test the sensory function. And I'm going to test the motor function first by palpating the masseter muscles. Can you glide your teeth for me? Okay, I can feel both the masseter muscles working symmetrically. And then I'm gonna test the sensory with my little cotton ball thing here. Just close your eyes and say now whenever you feel me touching you, okay?
Okay. Now. 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 Now.
I thought I was about to sneeze. Okay. Okay, so both of those were good. Now I'm going to move on to the cranial nerve number 7, the facial nerve. Can you raise your eyebrows real big for me? Can you close your eyes real tight? And can you give me a big toothy smile? Okay. Now I'm going to move on and check the lymph nodes. I'm going to palpate them, the pre-auricular, post-auricular, the occipital, the jugular-digastric, submandibular, submental, superficial clavicular. I can't talk today. The deep cervical, the posterior cervical chain, and then can you shrug your shoulders for me? The supraclavicular. Now I'm going to inspect the neck for symmetry. There are no masses or scarrings. And the trachea is midline. Can you lay on your back for me, please? I'm going to look for JVD. And can you turn your head to the right side for me? There's no bounding pulse and no distension. And then can you sit up for me? Alright. Now we're going to do a check, see if your thyroid is enlarged. Can you hold this glass of water for me? Okay. Can you go ahead and take a sip of it and hold it for me? I'm going to find the cricoid cartilage. Okay. Can you put your head down to the left, please? I'm going to slide the tracheas to the left. And can you swallow? Okay, no enlargement. And can you move your head? Can you take another sip of water? Down and to the right. Move the trachea and swallow. No enlargements there. Now I'm going to check for the parotid and submandibular salivary glands. They are non-palpable. Now I'm going to auscultate for a bruit using the bell of my stethoscope. Can you take a deep breath in and then exhale and hold it for me? Go ahead. 1, 2, 3. And you can breathe. Now I'm going to check range of motion. Can you move your head side to side for me? Can you do ear to shoulders? Can you go all the way back and then come chin to chest? Does that cause you any pain or discomfort?
No.
That tests for nuchal rigidity and meningitis. Now I'm going to test for cranial nerve 11. Can you shrug your shoulders for me? And can you do it one more time? Okay. Movement was smooth. There was no discomfort in any of those, and the muscle was even in the cranial nerve 11. Moving on with the eyes, we're going to inspect the eyebrows. They are smooth and symmetrical, smooth, good texture and full. The sclera is white with no abnormalities or redness. Can you close your eyelids for me? Eyelids approximate both equally and nicely. The eyelashes are present. And looking at the conjunctive sac, they are both red and no abnormalities. Everything is smooth. Now we're going to check for the extraocular eye movements. Can you follow my finger? The gaze was smooth and there was no mistake. The eyes tracked nicely and there was no nystagmus noted. Now we're going to use our Snellen eye chart. Can you go ahead and hold this for me and cover your right eye? Can you read here?
PECDF.
And here?
EDFCZP.
One more.
FELOPZD.
And put it on your left eye. And here.
EDFCZP.
And here.
FELOPZD.
And then take it off completely. And here.
FELOPDZ.
And here.
DEFPOTEZ.
Okay. And if there was a need, we would use the Jaeger card or our textbook in this case to test for near vision. Now we're going to check for Perla. Pupils are equally rounded. They're both about 3 to 5 centimeters. Can you look off for me? Shine a light to check direct constriction, and then consensual. Keep looking off for me, please. And the other eye constricts as well. Can you continue to stare off for me? We're going to check for accommodation. Both eyes track with a steady gaze. Now we're going to check for the red reflex with our ophthalmoscope. Can you continue to look off for me, please? You can see the red reflex, and as I move in, I'll begin to see the optic disc on the temporal side, the macula on the temporal side, and the optic disc on the nasal side. And now we're going to do the corneal light reflex, which is, can you look at the light for me here? Mm-hmm. The sparkle is in both eyes in the same spot. And then the cover test, can you look off for me? And then cover up this eye. Okay, continue to stare. Okay, and there's no weakness or nystagmus. And that's it for the eye. Starting with the ears, I'm going to inspect and palpate the external ear for any tenderness. There is no discharge coming out of either of them. Do you feel any tenderness or pain?
No.
Okay, she does have ear piercings. Do those cause you any trouble?
No.
Okay, now I'm going to get my otoscope. Pull the pinna up and back. There are some hairs, and I see the tympanic membrane is a pearly gray, and the light was coming back at 5 o'clock. Whisper test?
Mm-hmm.
So now I'm going to do the whisper test. Tap on her tragus.
Jarvis.
Jarvis, good. Moving on to the nose. I need to inspect the external nose for symmetry, see if there's any lesions or sores or abnormalities or anything. There is no drainage from the nose. To inspect the internal of the nose, I need to lean her head back and then pull her nose back. There seems to be no sores or anything on the septum. What does that look for?
Because you're trying to let
No sores or deviations on the septum. Check for the nose patency. Can you cover one nostril and breathe in the other? And do the other side. Okay, good. Moving on to the mouth. The lips are pink. There are no cracks or they're not chapped or anything. Can you open your mouth for me? She appears to have all of her teeth. Can you stick your tongue out for me? The tonsils are grade 2. Can you do the uvula and the tongue both fan out together? Can you put your tongue out and go side to side for me? And just stick it straight out. Okay? And then if I had a tongue blade, then I would use that to check the gag reflex. Going with chest and lungs, first thing I'll do would be inspect and palpate the posterior side of the chest for any lesions or pain or anything. Go ahead. You feel any pain?
No.
Any pain?
No.
Pain?
No.
Pain?
No.
Here?
No.
Here?
No.
Right here?
No.
Okay. Now I'll of course do that on the anterior side, but for the video I'm just going to do it on the posterior. Checking for the CBA tenderness. If you can stand up for me, I would find the costovertebral angle. Should be right here. Tell me if you feel any pain, okay?
No. No.
You have a seat. Then I would check the A to P. So the anterior to posterior should be 1 compared to the transverse, which should be 2. So 1 to 2, and it is. Then I would palpate for tactile fremus. I'm gonna do it on the posterior side. And every time you hear me, every time you hear me put my hand on your back, would you just say 99, please?
99, 99, 99, 99, 99, 99, 99, 99.
Okay. Felt it mainly in the bronchovesicular area. And then auscultate for lung sounds. Okay, every time I place this on your back, will you take a deep breath for me? You feeling winded?
Yes.
Okay. I would continue on with all 18 spots across the posterior side and then on the anterior side as well. Oh, and also you would make sure that that you were in a warm room that did not have any outside noises or anything that would be bothering you while you're trying to auscultate.
Just go.
Starting with the cardiovascular, we would first inspect and palpate the point of maximal impulse for sighs, lifts, thrills, and heaves, which would be the 5th intercostal space mid-clavicular line just below the nipple. And you would palpate for any lifts and just look for any thrills or heaves. Next, we would auscultate the heart. You would do this in the sitting, lying, and left lateral positions. And it is all patients take meds. Apical, which is the second intercostal space of the right of the sternum border. Then the pulmonary would be the second intercostal left of the sternum border. Then the tricuspid would be the 5th intercostal space left of the sternal border. Then the mitral valve would be the 5th intercostal space mid-clavicular line. And you would do it in a lazy Z pattern and not picking up your stethoscope throughout the process. Next, you would inspect for peripheral vascular and the color and varicosities or varicose veins. So the legs are consistent with the color of the rest of the skin. There is no varicose veins, and the temperature is warm to touch. Texture is smooth. We'll go ahead and look for edema now too. The edema grade is 1, and that scale goes from 1 to 4, and it is testing the rebound and the color of the skin. I think, or 4 is more than 30 seconds for the skin to come back and the color to go back. And then we can go ahead and assess the palpate the pulse sites. We have the temporal, the carotid, the apical, the brachial, the radial, the femoral, the popliteal,
Nothing.
popliteal, dorsalis pedis and the posterior tibula pulse. And then you would also check for the finger for the capillary refill and clubbing, but we did that in the first video already. For assessing the abdomen, you would first you would check for the skin to see if there's any different color variation throughout, which hers is consistent throughout and consistent with the rest of her body. You would inspect the umbilical or the umbilicus. Hers is inverted. There are no hernias or no pulsations above it. Next, you would auscultate the quadrants for bowel sounds, starting in the right lower quadrant, and then moving up to the right upper, then the left upper, then the left lower. She has vowel sounds, but if you were not to hear any, then you would have to continue to listen for 5 minutes to rule out completely. Next, you would percuss the quadrants, placing the joint right here of your middle finger on their body and tapping right behind the nail with your other finger. You should hear tympany in the lower quadrant of the abdomen, and then renaissance over the ribs, and then wherever there's an organ, you would hear dole. And then wherever you would hear dole sounds, you would mark it out with a pen. And you always want to auscultate before you percuss so you do not create any unnormal bowel sounds. Then you'll move on to the light and deep palpation. Light palpation, they're both for pain or discomfort or pulsations or masses. Light palpation is 1 centimeter deep, and then deep palpation is 5 to 8. So you would just go along in a circular motion along the abdomen. And then during deep palpation, if there is any kind of guarding, you would ask them to pick their legs up onto the bed like this and help them put their arms on their chest and just kind of get them to have relaxing thoughts and try to get them to relax. And then while you are assessing whenever you're palpating for the liver and spleen or the full bladder, that's whenever you would come right here and mark the sign, or mark where you heard where it went from tympany to dullness, and then from renaissance to dullness, and then same thing for the spleen. And then for the abdominal signs, for rebound tenderness, you would come to the opposite side, so the left side for the appendix, and push down at a 90-degree angle and ask them and then release quickly and ask them if they had any pain during that. And then if you're checking for the kidney, it would be on the right side, and you can use 2 techniques. You could cup liver, not kidney, liver. You would cup on the back, right below the ribs, and then put your other hand flat on the abdomen and have them take a deep breath and slowly put your hand up underneath. And if you bump it and it causes them pain, then that is a positive sign. You can also use the hooking technique for the liver, which is coming up above here, if this was her right side, and putting your hands like this, and then asking her to take a deep breath and hooking up underneath. And you can also use the same technique with the cupping the hand and the flat on top of the abdomen for the spleen. Then for the ileopsis test, you would have them put out their right leg and hold it up and apply some pressure down and ask if it causes them any problems. Did that cause you any?
No.
No? Okay. And then for whenever you went to inspect the inguinal nodes, they're in the upper groin area. Moving along with the musculoskeletal, You would inspect for any deformities, and you would observe their posture, which is straight. The head is erect. Everything is symmetrical. We assessed her gait earlier whenever she walked to the bathroom. Put the gown on. It was smooth and steady and stable. And if you can stand up, please, we'll assess your movements of the spine. If you can lean all the way back and all the way forward, and then rotate at your hips. Okay, and now if you could put your hands up like you're going to dive into a pool and bend all the way over. This is a test for scoliosis, and also you want to make sure that the scapula are symmetrical and aligned. You don't want there to be any protrusions in the back. You want to make sure that there's symmetry for the iliopsoid crest right above the shorts line. You can sit up, and you can sit down. And then you want to test for carpal tunnel. So to do that, you would have them put their hands back to back like this and press and hold it for 60 seconds. Also, you would want to tap here at the median nerve for the Tennel test. And whenever they're doing for the carpal tunnel, it'd be a burning or tingling sensation, and also a burning and tingling sensation here. Here's my paper. We already did the testing of the muscle strength. So now we would test the Romberg test. So if you could stand up again, I'm sorry. And then you have them close their eyes for 20 seconds and see if they can remain stable. And also you would have them do a heel to toe walk, which is like a sobriety test if they were falling over. Most people can do it without any trouble. You can sit back down. And then you would have them test the coordination of rapid movements, which would be the finger to thumb, and you would have them speed up as they go. And then also the finger to nose. So if you can touch your nose and then touch my finger. Okay. And then moving on to the sensory. You would take a sharp and dull object, and can you hold your hand out and close your eyes? Can you tell me if it's the sharp or the dull side?
Sharp. Sharp. Dull.
Mm-hmm.
Sharp. Sharp. Dull. Dull.
Okay. And then also you would test for stereogenosis. Can you close your eyes and reach out your hand and tell me what this is?
Pill bottom.
Yep. And then also for the graphothesia, I will just draw something in her hand and see if she can tell me what it is.
A.
Correct. And then also we're going to test one of the deep tendon reflexes, the patellar. So I'm going to take my reflex hammer here and just hit it right below the patella.
Stop.
And get that tendon to elicit. And then going back to the self breast examination, you would teach somebody to do it in the shower 4 to 7 days before their menstrual cycle, and they could either use the vertical line test or the circular or the spokes, and you would have them go all the way to the sterno border, and then do the other side starting in the axillary tail of Spence coming in. And then once they get out of the shower, stand in front of the mirror and raise their arms up and see if the breasts rise and fall the same on the hips, and then placing their hands together. And then also once they dry off and they're laying down in their bed, to do the same, conduct the same, whether it's the vertical line or the circular or the spokes.